Hi, and welcome to Medicare 2021, What You Need to Know. I am Melissa Joy, and I am so pleased to be joined today by our Medicare guru, Joanne Giardini Russel. Hi, Joanne.
Hi, Melissa.
Thank you so much for attending or for being here. We're going to dive right into a presentation, and this is very conversational. Our goal is to make your Medicare life easier and better. And so we really hope that if you do have questions, you'll email me and we'll answer those at the end of the presentation. My email address is Melissa, Melissa at pearlplan.com. And we'll include that at the end as well. So when we're taking questions, we'll make sure to give you a reminder. So I'm just going to share the screen really quickly. And then we're kind of going to hand the reins over to Joanne. I want to make sure that today we're covering both the topics of the annual enrollment period for Medicare, as well as you are able to be thinking, if you're already enrolled in Medicare, what may be changing. This is a strange year. So first we have, kind of the turning of the calendar into 2021, but we also have COVID-19. So we'll be also addressing some special topics related to COVID. Joanne, can you see my screen?
I can. Yep.
Okay, good.
Thanks.
Okay, so just as a point of reference, I'm Melissa Joy. I'm a financial planner and founder of Pearl Planning, and Joanne is the founder of Giardini Medicare. Our companies are both toddlers. We are a couple years old, and we're doing a lot of, kind of forward-thinking planning on both financial planning and then healthcare topics with Joanne. So we've had a lot of fun kind of working together. Here's our agenda today. We're going to talk about what is Medicare, just the basics. You probably already have a really solid idea and foundation there. And then we're going to talk about turning 65 versus the annual enrollment period. So we'll kind of touch on those of you who may be anticipating enrolling in Medicare and those of you who have been using it over time, changes for 2021, and then COVID-19 and Medicare, and then coordinating your financial plan with Medicare. So that's where there's a little more complexity, thinking about how your financial plan can be enhanced by your Medicare planning. So Joanne, let's get started. Give me the basics of kind of what is Medicare and how do you talk to people about it?
Yeah, it's funny. So when we talk about what is Medicare, just first think of Medicare as just insurance. And I know that sounds kind of strange, but if people just start thinking of Medicare as regular insurance, it makes it easier for your brain to kind of process because it's offered by the government. And as soon as you mention that part, people start losing it, like either complexity or just don't want to deal with that kind of stuff, right? It just takes on a different onus when you throw in that it's sponsored by the U.S. government.
It's so true. It becomes more complicated in your mind. Insurance is already complicated anyway.
Right. So then if we can just step back and just say, look, it's insurance, you can get it from the government if you need it or want it. That's kind of how we want you to look at it. But you're right. It's convoluted. It gets, we've all dealt with whether it's just going to get our driver's license renewed, right? And going crazy there. This is something even worse, right? So at the end of the day, it's insurance. You can get it from the government. So there's a couple different levels or areas of people that can qualify to go get this. It's when you're 65 years old, number one.
Okay.
You qualify just by being 65 by virtue of that. Generally, there's citizenship parameters, things like that. We're not going to touch green cards and all that kind of stuff.
But most of us qualify.
Yeah, exactly. Most qualify when you're 65. So just realize you qualify. Now, you're not hearing me say you have to go get it, right? You're just hearing that you qualify to have it if you'd like to have it. So that's something to understand too, is a lot of people think they have to go get it. No. You might want it, you might not want it. So that's kind of one thing. There's a couple other subsectors. People might be listening to this that Social Security. So if you're on SSDI, getting checks for being on Social Security as income, after 24 months, you'll qualify for Medicare. Not everybody either has to also take Part B of that. You'll get one part of it. You'll at least get Part A. So just know that you can have that though after 24 months. A couple other areas, there are illnesses, unfortunately. So if somebody has ALS in our country and end-stage renal disease, they're sort of fast-tracked and get Medicare quickly. So those are situations that unfortunately they will get Medicare, or fortunately I should say. So that's what Medicare is. It's two parts. It's Part A and Part B. A lot of people know A is hospital and B is more the medical portion, kind of the doctors, the x-rays, the CAT scans, everything that you kind of think of as maybe your Blue Cross insurance. That's what the Part B portion is.
Okay.
Part A, people kind of consider it's free. This is the stuff that you've paid into your whole life. So you prepaid it. Not quite free, but you prepaid it.
There's a difference. Yeah.
There is a difference, but some people come into the system of Medicare very surprised that there's cost at all. So I'll talk about that in a second, but there's quite a bit of cost actually, but they think that, oh, I paid in my whole life, so why is there a cost? Well, you prepaid your Part A, but not the Part B, which is the other part. So Part A is the hospital coverage, and that just means room and board. You go stay in a hospital, it's going to pay for that coverage overnight. That's it. You know, seriously, room and board. It's going to pay for some other things like hospice and some other areas and skilled nursing facilities, but it's really room and board facility kind of coverage. The rest that people really struggle with and pay for is Part B as in boy. And that is insurance portion. That is, you know, like I said, your CAT scans, your medical, your all that doctor stuff that you think of. That's the stuff that is they charge a premium. So the government will charge you a premium, just like Blue Cross is going to charge you a premium. It's that simple. You're going to pay somebody a premium for your insurance at some point, right? So it might be the government, might be Blue Cross, whatever. So that's the part two that you don't have to take necessarily. So some people get to the Medicare age and they enroll in maybe just Part A because they're still working and they have work insurance. So they don't need Part B, right? So there's different parameters. The hardest part of Medicare is just that there's not a true yes or no answer for anything, unfortunately.
Now, is there a yes or no answer if someone is talking to someone like you where they explain their circumstances?
Yes. Yes.
It's just
it's like, okay, today, you know, if I'm on marketplace insurance, I'm getting a subsidy. I only pay $126 a month because I have a subsidy with the ACA and the marketplace, Obamacare, whatever, you know, all the same, that's all the same stuff. If that's a person talking to me and they're turning 65 in December, you're automatic Medicare. You have to get off a subsidy and you got to start paying the Medicare. That's it. That's what happens. That's an automatic. If you have somebody, I'm working at Chrysler. I'm going to be 65 in December. I'm working at Chrysler. I'm going to keep working at Chrysler. How's your health? Great. Okay. Do you contribute to an HSA? Yeah, I do. You know, my wife's on the plan. You can just sign up for Part A of Medicare, or actually if you're contributing to an HSA, then you don't sign up for Part A of Medicare. So that would be concrete advice though. We would say, okay, keep your HSA going. Do not do A, do not do B. So then yes, that becomes concrete in terms of a diagnosis, but it's not easy for someone to go figure those parameters out by themselves online, right? Or asking a friend, or even coming to Melissa. As much as you know about everything, you don't live in Medicare space all day long like we do.
No, I usually know a direction where I think things are going to end up, but there's a lot of important questions. Are you working for a small employer or a large employer? You know, a lot of people assume that they would prefer COBRA over Medicare, and that is typically absolutely not. We'll talk about that more later, but there's a lot of, there are a lot of unique factors. Someone that thinks about it all day, like you, Joanne, typically knows the direction to steer you towards. Sometimes there's a decision, but typically there's a, you know, kind of preferred choice. In a consultative kind of approach is very helpful versus just a blind eye, yes or no, I'm signing up.
No doubt. And sometimes it's a little bit of a gray zone. You know, there was someone I talked to recently that he's struggling with an illness, and if he adds Part B, yeah, it can take away some of his costs that are out of pocket right now. But what I told him clearly is that you're going to kind of limit your chances or your choices later when you get to us and you need us in 3 years. It does some bad things. So, you know, he just made an educated, best decision for him. I probably wouldn't have not enrolled in Part B, but he did. And that's okay. You know, we'll deal with what we can deal with later. So it's not always super, super crisp and clear, but most of the time it really is actually, but you just have to know those pivots. And I've seen your flow charts that you have that are phenomenal. It's like 4 pages of directions and it makes your brain want to explode. So that's how, that's how the average person feels with this stuff. That's why it's a lot easier just to call us and like, hey, I've got this and this and this and this, and I wanted to, okay, you don't need us right now. Oh, okay, you need Medicare. Okay.
Totally. The flowcharts are good for explaining how complicated things are.
Yes.
And then there's additionally, you may make a decision between Medigap, Medicare Advantage, and there's Part D considerations as well, correct?
Right. So once somebody commits to the Medicare side of things, okay, I'm going to take Medicare. I need Medicare. Okay. Well, then we come into play, and this is how we're actually paid as agents. So we're, at the end of the day, we're brokers. We're brokers. We get paid just like your home and auto insurance people do. So that's how we're compensated.
Right.
When we help people sign up for Part A and B and all that kind of stuff we do, that's just extra. That's part of our service that we believe in helping the person with, giving you the forms, telling you what to do, et cetera, et cetera. But when they get to the point where they have to decide on a product, that becomes really, really difficult too, because number one, you've got all these people and friends just yakking and telling you what to do and what you should do and all this kind of stuff. All products aren't always equally displayed or educated or given you education about by agents, quite frankly, because some have higher commissions than others. So I think there's a bias in the industry definitely towards one over the other. But that lends to a lot of the confusion. There's no central source to go find out information. There are SHIP counselors here in Michigan. We have these counselors that consult with Medicare, but they're volunteers. Some are really good, some are not so good. Some people will call Social Security Administration asking for help about Medicare advice. Number one, they're not allowed to give it, but they do sometimes. They shouldn't, but they do. And people have to understand that Medicare division is not Social Security. So you're calling Social Security, you're not calling Medicare. And if you call Medicare about certain things, they don't know. So it's very, that's the government part that's crazy. That's where people get all that blah. And I get that because it is kind of crazy. So yeah. And then if you go back to Medigap and Medicare Advantage, you've got this funny product, and I like to throw it out to the consumers because they laugh when they hear me talk about this. But I had a guy, a pilot in Florida. He's newly retired. He's 65. So with pilots, you get thrown out of the airlines at 65 years old. So he's done. So his girlfriend, he told me this yesterday's story. She had a retirement party for him. So I'm just like, well, that's great, John. Was it fun? Blah, blah, blah. And he said, yeah. He goes, and one of my buddies, he showed me that he pays $0 for his Medicare. And I started laughing like, okay, they're all going to tell you they pay $0. And he goes, no, but I took a picture of his ID card so I can show you. So he's texting me the picture of his friend's ID card of his Medicare product. This is at the guy's retirement party. So
this is typical behavior. Yes,
it is.
There's a lot of
so
water cooler or barbecue grill advice.
Yes. And this is classic. So when people, our Medicare folks hear this, they start laughing because they're like, oh yeah, I just was talking on Friday night, whatever. So there's so much in that goes on. Just realize. And so when I looked at his card, I said, well, John, that's the HMO that you said you didn't want. He goes, I don't want an HMO, I want a PPO. And it said right on there, referrals are required. So that's the thing you have to understand. Your friend's going to tell you he pays $0, but he's not telling you the downside of the plan. So you've got two programs. One, in essence, is called Medigap. And all you're doing here is you're paying a fixed monthly premium to buy a policy that pays everything Medicare does not pay for. It is that simple. You can go anywhere you want in the country. You can go anywhere that takes Medicare, any doctor, no referrals, no nothing, no copays, no co-insurance. It's fabulous. It's that simple. You're going to pay a premium for that every month, a price tag. In Michigan, for a 65-year-old, it's about $125 a month. That's it. You can go Medicare Advantage, totally different system. Yes, you can pay $0 for that. You can. It truly is $0. However, you will have restrictions. You will have networks. You'll have copays. You'll have co-insurance. You can't go to any doctor you want to go to. You can't do certain things. You'll have a max out of pocket, kind of like your group insurance, but a little more could be limiting. So if you're the type of person that cares about going to MD Anderson if you get sick, you may not want that kind of a plan. Where we see the biggest problem with those plans is that people don't understand them on the surface when they're making their first decision with Medicare. They go into those programs because they're healthy, they're not taking any medications at 65, everything's golden. And then 4 years later, they come back to us and say, you know what, I got a heart condition now. And I remember you talking about Medigap way back when. So now I want that good stuff. You can't have it. So you are medically underwritten. So people do not understand that they can be declined for the coverage when they need it and want it. It's just like buying your homeowners after your house burns down. A silly analogy, right? You just can't do it. So
there is some portability, but if you have significant medical issues that didn't exist originally, there's one window when you don't have that underwriting, which is when you're originally enrolling. Is that
when
correct?
you're first enrolled. So when you're first, your very first 6 months in Part B coverage. It doesn't mean 65 years old. It just means your very first 6 months in Part B coverage. You have a special window.
That's a good kind of transition point to our next area of conversation, which is, I use the term turning 65, but you can say when it makes sense to initiate your coverage.
Right.
Versus we're coming into a time of year that a lot of people link to Medicare, the annual election period.
Yep.
So what is the difference?
So the difference is when you're transitioning to Medicare, that could be at 65, could be 68, 72, whatever it is. When you decide you need to go on the Medicare system, that's the transition portion. That's very different than our annual election period. Some people get confused, and it's kind of comical, yet it's not. Some people think they can only retire in the fall because they think that's the only time they can get their Medicare. So they will hold their retirement off for 9-10 months all year because they think they can only transition over to the system, which just cracks me up. It's like, no, you can retire in February, you can retire in March, you can retire in April. So that's not tied to this. The only thing that this thing is, it's the annual election window. What it is people that are on Medicare Advantage plans with the networks and the copays and the zeros and all that kind of stuff. If they want, let's just say their friend has Medigap with us and they just told them how great it is and they don't pay anything, they love it. And that person says, I had no idea that existed. Because again, a lot of times people just aren't exposed to that there's two options. So that's something we always harp about, that there's two choices. If they don't know that, they don't know that. So if they hear about it and say, you know, I think I'd prefer that, that's their time to contact us and we can put them into underwriting. If you have higher blood pressure, you have higher cholesterol, you're fine. You'll get approved, right? If you had a stent put in 2 weeks ago, you're not going to get approved. If you have ALS, you have Parkinson's, you're not getting approved, okay? So it's an important thing, but it's not to say that nobody can pass underwriting. So what we do during the annual election time is say to those people, okay, we can get you underwritten. You start your new plan January 1st. Great, you're done. If I have somebody in a Medicare Advantage plan that happens in our backyard of Michigan to not like the Blue Cross plan this year and they want to go to Priority Health or HAP or something like that, that's our window where we can change them too. That's fine. So the third thing we do that's really important is people with Medigap also carry a standalone prescription drug plan. Those people, it's really, really important for them to get an assessment done on their drug plans because there's 30 plans in Michigan alone. They're not all created equal. Every September, the carriers will send out the new data to the people and say, hey, these are the changes in your plan. 7 out of 10 people don't read it, right? They don't find out about the changes until February of next year, and they can't change their plan then. So you only have this window to go change your plan. So you want to know now that your drug fell off a formulary or that your CVS isn't preferred anymore, right? Or your plan premium doubled or things like that. If you don't pay attention to those notices, you're stuck. If you let it roll over, you're stuck for another year. So take that opportunity to go back to your agent, have them run your drug plan, because again, there's 30 of them and they're constantly, it's a shell game. They're just changing so that, in my opinion, they just take more of your money and it just happens. So we've seen swings of $3,000, $4,000 saved by switching a drug plan in a year. That's not average, but it can happen. So
in my experience, the way that we approach this, first, if you're approaching Medicare age or, you need to sort through what is appropriate, have an initial consult. Even sometimes I mark the calendar for age 64 and a half. On your half birthday, coming up around rounding the corner to age 65 is a good time to have a consult call. It doesn't have to be in, the month before, and then you can kind of line up your decisions and know in advance as you're kind of being inundated from information, know what your game plan is.
Yeah.
And then when I meet with clients at any point in the year, I will say, hey, especially if they're a new client I haven't worked with, or they're talking about the cost of their Medicare, we just want to do kind of a checkup. Then oftentimes I'll mention, hey, contact Joanne or her team. And why don't you just have an initial consult, talk about what drug, what prescriptions you have, as well as your needs and how it's going. And what I like is oftentimes in those consults, it's like, nope, they're all set, they're good. Or maybe we'll talk in a couple years when the wife turns 65 or whatever. But in some cases, there are either a need to change financially or an approach that might be more appropriate. So it's a consultative conversation, and then
Right.
you kind of line them up during the year and then make the changes in this
Right. And then we
window.
keep them in our system too, so that then they have this kind of guide that they can kind of, because I have people, that maybe 3 years ago got in our system. And then all of a sudden, now they're like, oh, now I'm ready. And I remember I sometimes I'm like, oh my gosh, you're 65 already. And I look back, it's like, oh yeah, I met her when she was 62. So we get a lot of that, but then they feel comfortable because we every month we're giving them a piece of information about Medicare, so they can start paying attention when they want. We've got our YouTube channel. You do a great job giving out our workbook. So we have that guidebook that you use for your clients. So if anyone needs the guidebook, go to Melissa and get the guidebook, because we created a 37-page book that just walks you through a lot of this stuff, so you can track it, you can organize it yourself. What we try and do too is leave you alone. We want to educate the heck out of you, but leave you alone and not bother you, because our world of Medicare is built on just pesky, horrible, the insurance industry isn't so great sometimes. So ask any 65-year-old how many phone calls they get. They're deluged and they hate it. So, we take the opposite approach. You come get us when you need us, right? You have a conversation. It's no charge. We might not talk to you for 2 years or 5 years. It's fine. It's totally fine. So it's fun to be able to operate like that, right? It's just very nice.
It's a breath of fresh air, and I'll provide your website information, but you are very informational. So it's kind of a give to get strategy where you're really giving a lot of information that is valuable for anybody that may be enrolling. And a lot of people, this is a really big deal for everyone. So they want to be informed and educated, and it can be an intimidating conversation.
And it affects beyond just you, the consumer, signing up for this. We have a fair amount of single women, which I will say it's, sometimes it's tough, and they don't want to maybe have co-pays or costs that might be left to their kids. So that's very important to them to make sure they have the best you know what I mean? It's just, it goes beyond just a product. It's a family kind of thing, and it affects many people too. Or if somebody doesn't have, again, we're always trying to bring them back to go see Melissa, because long-term care is not covered. So if you need this for your mom, you know what I mean? It's super important to open up those floodgates of conversation, and they get opened. As you know, you can have some really good conversations related and started with the Medicare piece, long-term care, all that kind of stuff. So it's
true.
It's amazing. So
yeah. It's great when you can coordinate between the two. And we're going to talk about a little bit more about that in a few minutes. So what is changing this year? We're going to save coronavirus for its own separate bullet point.
Yeah.
But is there anything, there were big changes that came through in 2020. I think part F and G, right? Or
That's right. Yeah, I forgot of that already, actually. Plan F and Plan C. Thank God it's been gone for a while, because that was in the works for 5 years and it's gone. So Plan F and Plan C, Frank and Charlie, those are no longer offered to new people. So the older folks, they can still get them. We've kind of even gotten off the conversation, thankfully, like I said. Big changes for 2021. The two biggest are going to be people that take insulin. So your type 1 insulin taking diabetic folks, there's a list from CMS we have right now it's about 2 pages long. So there's some meds, I think, like Toujeo. I'm trying to think of the meds, Novolog, I think, are some of them, and they're pricey. So some of these people are paying $300, $400, $500 a month for those specific medications. Certain Part D carriers, certain Medicare Advantage carriers, if they choose to participate with this new program, it will cap the insulin at $35 a month. So that, for certain people, is going to be huge.
Good.
A lot of diabetics. So it's just, hopefully that's going to be helpful to a lot of people. We're not seeing a ton. I think there's like 8 Part D carriers now that are doing it. It's not all 30 are going to participate, but it's okay. The second big change, Medicare Advantage will allow end-stage renal disease folks into their plans. First time ever. There used to be only one parameter that could keep you out of Medicare Advantage, and that was end-stage renal. So now they've taken that off. Good part is there's 100,000 people on dialysis that can now get those plans. Might increase max out-of-pockets a little bit for other people. So we're kind of I think we're seeing a little bit, they're going up at least a few $100s a year for everybody else, because they have to collect that money back. Right. Dialysis is $10,000 a month kind of thing. So It's pricey. So those are the two biggest changes that we're seeing right now, other than your usual, like I said, again, your Part D, all that stuff always changes, but these are kind of major philosophical kind of changes. So
good
yeah.
to know. So it's always good. That's what part of this kind of update is. We're checking in and saying what's different. Also, what do you need to remember, and a little refresher course.
Right.
Now, the other change is not government policy. It's we're living with Medicare during a pandemic. And that, you know, we can talk about what people that are sick, what, you know, having living during a pandemic means with Medicare, but also there's huge disruptions to the job market. So some people are choosing to retire early because they are being asked to go to workplaces they may not feel safe in. People are accelerating their retirements just in general. And then, you know, there's layoffs and unemployment. So that is a big part of the conversation, because the decision between Medicare coverage, if you're eligible, versus COBRA is a really important, you can mess that decision up. So let's talk about what you're talking about with COVID-19 and Medicare.
Yeah. So when COVID started, you know, back in March when it really hit, I would say we had a lot of phone calls in the beginning, just more, how are you doing with COVID kind of thing. And it was interesting because we've always been virtual. So this has always been our world.
You were built for this.
We were built for this, which is really sad, but we kind of like, well, you know, waiting for the world to catch up. We didn't think it would happen that way, but it's amazing. So that piece wasn't anything surprising to us. What was a little bit surprising, and I never thought of it right in the outset, was that, you know, you had a shutdown instantly and furloughs instantly. So we had people with that, number one, calling the panic of a furlough, and they don't know if they're going back. The second piece was exactly what you said, the anxiety in the workplace. A lot of nurses at Beaumont, you know, I felt like nurses were calling just out of closets kind of everywhere they were. Just like, oh my gosh, you know, I remember one woman, 66, she's terrified. She's going to bring COVID home to her husband who's 68. So she said, I don't think I can make it till the end of the year, when I was planning on retiring. So she wanted out. I remember another doctor happened to be a psychiatrist, and he's 74, and he told me he had to retire due to COVID, and I couldn't connect the dots as to why is a psychiatrist having to retire, because I'm thinking of a psychiatrist in a private office. He worked in the ER, and he said, I just can't risk it and bring it home. And I just wasn't prepared for some of the stories like that. A lot of doctors, those are highly stressed positions this year. You know, you're right. They might have,
and financially stressed too. The medical systems are, so it's not the most happy
there's
work
layoffs,
environment.
right? Layoffs, and you know, the market went crazy at the beginning of COVID in the beginning part, so they had a lot of stress going on. But a lot just, I'm going to be done in December anyway. Forget it. I'm done. June 1st, I'm done. So we had a lot of that. And then as time has gone on, we're now starting to see another uptick of the furloughs being over, and now they're permanent layoffs. So that always presents another, you know, headache. So the biggest thing we're seeing, though, related to all of that is exactly what you said, the COBRA piece. So the COBRA, there's a lot of COBRA offers on the table for people. There's a lot of COBRA paperwork in the hands of consumers. HR does not do the best job. It's not their role, and I understand it. But when you've got somebody leaving the workplace and they're over 65 years old, the worst thing they can do is just take COBRA. So my story, I'll never forget this guy. John calls me on end of May. No, he called me June 2nd, I think it was. He lost his job end of May. He's 70 years old. He lost his job May 26th, right after Labor Day, or whatever day that was. He had 5 days to prep, because their coverage will typically go through the end of the month. He's got 5 days. So he was panicked, number one. He's been at the place for 35 years, number two. He wasn't prepared to get let go, number three. Number four, his wife was having chemo on the following Tuesday. So he was very, very worried about medical insurance, right? Because she's having chemo, $13,000 a session, and it's a big deal. So he got to me, I don't remember even how, but I said, did you ever get Part B of Medicare? Again, he and his wife were both 70. And they got Part A when they were 65. They did the right thing. I said, you did the right thing. Absolutely. Now you're getting COBRA. Did anyone tell you to go get Part B, or did you start getting that? He goes, no, because I have COBRA. Right. So what happens technically is when somebody is his age and he's on COBRA, Medicare automatically by default becomes his primary insurance company, only because he's over 65. He's eligible. So when you're eligible for Medicare and you're on COBRA, you have to have your Medicare set up. He did not have his Medicare set up. He only had Part A. So that doesn't count. So I told him, we need to hook it up immediately. So we did, and we got it backdated to June 1st, because if he didn't, and his wife had that $13,000 chemo session, they will technically bill Part B first for her. She doesn't have it in place, right? So therefore, the carrier might pay the bill on the spot, bet you $1 million they will have an audit, and they'll come back and say, well, we paid for these chemo sessions every 3 weeks for you, and we shouldn't have done that because you didn't have Part B. You should have had Part B paying. And they will send a bill to the consumer. He can have a bill for $75,000 in his hands in a couple of years. And we've seen it happen. So people don't know that it can happen. It's a very simple, we just get the guidebook, the Medicare and You guidebook online, and then it shows you the chart. You know, if you're on COBRA, Medicare is your primary insurance company. It's very simple. You need Medicare. So he was a case where we didn't leave him on COBRA because he was also paying $1,500 or $1,800 a month for COBRA for the two of them. So we pulled him off the COBRA and gave him each a Medigap plan for $150. Handled her chemo beautifully, saved him a fortune, and I've not heard from him since. And he was the most paranoid person you've seen ever. You know, just for days pinging me, I think,
for good reason.
with
Yeah.
text messages. Yeah. And I haven't talked to him in 3 months. So, you know, that kind of stuff. And it was just sort of accidental that he got in our hands, but HR doesn't hand you that little sticky note, like, you're over 65, you need to go do this. They just don't. That's just kind of not their role. But we've argued for years, whose role is it, right? Is it the group person? You're coming off group. Somebody knows you're 65 plus, and somebody knows you're taking COBRA. So it's a really big trap that a lot of people fall into, a lot. The other thing with COBRA is that some of these employers, to be generous and nice, and it is, they are paying for the COBRA insurance for like the first 3, 4, 5, 6 months, something like that. So I have a new guy who's December. They're paying for his COBRA from July 1st until December. That's great. You're still 66 years old. You need your Medicare set up. But I have free COBRA. That's okay. You need your Medicare set up. So they don't, until they can really understand that. And we've got a really good video about COBRA that Cameron did. It's an excellent tool. So all I do is I send that to people. I'm like, look, just watch this. And then they call panicked, like, okay, I get it. I'll go get my Medicare. But it's really important that they do that. But again, because you're not paying for it, okay, we'll do your Medicare and then we'll keep the free COBRA and then we'll take that away and then put Medigap in place within your 6-month window still. So we can work with that. I'm not saying go Medigap today, but just go get your Medicare Part B. So that, like I said, is the biggest thing we're seeing problems with this year. And it just feels like nobody catches it. So it's just exhausting. I just feel like we scream about COBRA and Medicare all the time. But there's a lot of that going on, you know. And
I think it goes back to your original conversation that is, Medicare feels really complicated. People feel comfortable with employer insurance in many cases. They know what they have and they feel like it's done the service that they've needed, hopefully. And so, you know, that and the desire for familiarity is automatically, when you hear COBRA, oh, I've got this bridge where I don't have to make a change yet.
Right.
Then that is just natural behavioral instinct.
It is. And you've also been in an employer space for 30 or 40 years where you had, you know, you could pick door number 1 or door number 2 every year, right? That's it. That was as complicated as open enrollment got. I mean, you had to make your, right, you had to sign off and click your boxes or my kid's not on, whatever.
Right.
But that was it. That was not, oh, I've got 55 plans here. I've got 35 plans here. I got to, you know, you've got the inroads, you know, drug plans, there's 30, Medigap, there's 10, there's 55 Medicare Advantage plans in Wayne County. You know, where do you start? It's like and people, you just get, and I hear this all the time. I'm 65 and I have to deal with this stuff now. Are you kidding me? It's the opposite, right? You're just supposed to kind of relax a little, and it's overwhelming. So, and I take for granted sometimes how much I think we know because we try and dumb it down in a positive way. Like, you know what, if you're not choosing Medicare Advantage, who cares about the 55 plans in Wayne County, right? So it's, yeah, there's a lot to it.
I think that's really helpful. I mean, everyone at Giardini Medicare is consultative but conversational. So You can get complicated, and obviously you have your knowledge, but it doesn't have to, every conversation doesn't have to get way into the weeds.
No.
And for me, I think kind of pulling this conversation together, and we want to remind you that we do have time for questions if you want to email us. We're getting to that time. Email me at melissa@pearlplan.com. And if you're watching the recording of this, don't hesitate to email follow-up questions. But your Medicare decisions should be coordinated within your financial plan. And healthcare costs in retirement are very costly. Healthcare inflates at a higher inflation rate than your normal expenses during retirement. And so my goal is that you make a good Medicare decision, and in many cases it would be great to have the consultation and help of a Medicare professional. But then you're also planning for those costs that you have in retirement, acknowledging that in many cases people need long-term care or skilled care toward the end of life, and that this is an additional cost that, we kind of put into your financial plan. There are some interesting saving strategies nowadays if you are still working and are listening to this, including health savings accounts that in a moment, once you enroll in Medicare, are not a good idea to be contributing to because it's a problem. So if you can coordinate the complexities of financial planning in a year like this, one of the things I'm thinking about with COVID-19 and Medicare is maybe you got the chance to return your required distributions, and this may mean that your tax on your Medicare premiums, your IRMA, your higher premiums may be able to go down because we can control taxes a little more this year. So there's a lot of things, kind of moving parts going on. Your Medicare decision is really important, and it should be kind of coordinated in context of your overall retirement plan. One decision like a Roth conversion strategy may boost up your Medicare costs. So, you've got to kind of negotiate the different decisions that you make for helping one part of your life. Will it impact a different part?
That to me, Melissa, is huge because I work with a ton of financial planners. We work with, we kind of value you all as partners.
Right.
And we're always trying to get that message that it's linked. It's, it's super important to draw that into your financial planner. What's interesting is we do sessions with credit unions, and when pre-COVID, when it was live, I would always go in and I'd have 75 people in a room. And I always like to ask the question, who thinks of your financial advisor as a resource for Medicare? And never out of probably 1,500 people did one hand go up in the air. And I just found that so backwards. So I love how you integrate it and to say this is part of you are the resource. And I think your clients have a different view about you. But I can, like I said, 1,500 people, one person raises their hand to think of their planner. It's like, that's crazy because you have your pulse on their whole world, and that's what's super cool about just integrating. And it just makes so much sense to do it the way you all do it at Pearl Planning. I just think it's outstanding. So keep it going. Let's do this every year. Yeah.
Likewise. So we're kind of wrapping up, but I want to make sure, first of all, we'll be sending out this recording in our regular newsletter, and we'll make sure to include some of the resources that we've mentioned, like that Cobra video. I actually recorded a podcast with Cameron, who works with you, Joanne, at the beginning of COVID-19, just talking about COVID-19 and Medicare. So we'll include some of those resources. I can talk a little bit about IRMA. So we'll have links to those. But if you do have, kind of follow-up questions, conversations, first of all, both of our websites have a lot of resources. They're informational, not just a sales funnel. And don't hesitate to sign up for our newsletters, which are also available direct at the websites, or schedule a call if you need a consultation. Joanne and her team, as she mentioned, are entirely virtual. Do you want to mention anything about contacting, how you work with people?
We let like I said, we don't pester you all. We let you kind of come to us. So their phone number is the main number. Any of these folks will pick up the line as you call in. You can schedule. You can go to the main website. You can email. That's fine. A lot of times I'm just emailing, even nighttime or texting, whatever. So try those channels. Everybody is really good. I tend to be like the face and coming out here and doing the most of the stuff and talking. I'm not the only one who knows Medicare up and down. So every person, my youngest has just joined our team, and then we're gonna have another agent start in January. So we're growing. It's that busy. It's kind of crazy. There's just we forgot to change Boomer Health Group on the top there, so I don't want to confuse anybody. It says how to contact Boomer
sorry.
Health Group. That's okay.
Focus right
I don't
here.
want everyone to get confused by reading it, but that we had trademarking issues when we went to trademark our old name, so we changed a year ago to Giardini Medicare. So stuck with our last name. So anyway, that is one and the same. We do get some people looking for Boomer, so it's not a bad thing to talk about. But it seems so long ago that I kind of forget about it. So yeah, we're very low key, very easy to talk to, or, to contact. So any way you want to reach us is great.
That's perfect. And then, like I said, here's my email, melissa@pearlplan.com. Last chance for questions. If you want to just shoot us an email, I'm looking at my inbox as we speak. But my team as well, we have a Grosse Pointe office now with Melissa Friedenberg working there. And then we're located in Dexter, but we work with clients around the country. And, for me, the most important thing to mention is that we just think about these types of decisions as an opportunity to kind of make financial decisions with confidence, which is what we're all about. Kind of the compounding returns of good financial decisions, good decisions in general, can really pay off for people and reduce headaches and hassles over time. So I don't see any questions, but we're both available for follow-up. So I'm sure everybody listening has a chance, knows how to find us. And then also, we'll include this recording in case you know people who should be listening to it. Thanks again for joining us. Anything you would leave us with kind of just as advice or takeaways?
No, just have a successful annual election period. So if you're on Medicare, just make it successful every year for you. We joke how you plan your teeth cleaning gets on your calendar every 6 months, right? COVID aside, but every 6 months you make that religious thing and you go get your teeth cleaned. Kind of make us the same way, just make it your annual 1 hour and then you can tuck it away for the rest of the year and just be smart. You can tune out the commercials and all the craziness too. So it's a win-win for you guys, but, thanks for including this as part of your fall, review. Yeah. It's great. It's, and I'd like to get a jump on it too. So good for you guys.
Well, that's why the Boomer Health Group was listed in the presentation, because we kind of built upon our presentation last year. So we'll be doing it again next year. Yeah. And we always like to keep you updated as things change over time.
Yeah.
So thanks a lot and have a great day.
You too.